So good morning everyone and Happy New Year. Today we will continue with our size of the chest part 4. It will be the first presentation in this new year, the 2020. We will continue from where we left last time with the tapered borders or ball under the rug sign. What does that mean? If there is a mass on the chest wall from the inside, if the borders are wide, the angle is wide like here, it means that the mass is extrapulmonary. It's arising from the pleura. While if the edges are acute or the angle are acute, it means the mass is from the lung. We'll see now. If the angles are obtuse, it means it is pleural or extrapleural location. What does that mean? It means that if the mass is from the lung, the angle that it makes with the chest wall from the inside will be acute, sharp. While if it is from the pleura or the chest wall, okay, the angle that it will make will be wide. Okay? That's the ball under rug. Rug means سجادة يعني أو زولية or whatever you call it. Okay? So if the ball is under the pleura, it will make this angle. While if it is over on the rug, it will make an acute angle. So it's a sign helpful for localization of masses on a chest x-ray. Okay? Like you can see here, for example, this mass here, the angle is wide, obtuse, means the mass is arising like this cat here from the rug or under the rug. Okay? It's not from the lung. Okay? Another example, you can see here, this is a mass, it's a retrocardiac mass. The angle it makes is sharp, narrow. You can see here the angle, it's acute, not wide like we see before. Indicates that it is a ball on the rug, not under the rug. Means it is pulmonary in location. It is from the lung, not from the pleura. واضح? Get it? Again, this is a mass here. The angle here is wide. So it is over or under the rug? Under the rug. Okay? It is from not from the lung. It is from the pleura or extrapleural. Okay? Another example. Where is the origin of this mass? From lung, yes, because it is over the rug. The angle here is what? Sharp, acute. Okay, like you see it here on the CT. Yeah, you might be, well, it might be from the pleura, it might be from the lung, I'm not so sure. Well, just look for the angle it makes. If it is acute, it's from the lung. If it is wide, it is from the pleura or extrapleural surfaces. Okay? Now the next sign is a very, very famous sign, which is the S sign of Golden. What does S sign of Golden mean? Right hilar mass causing bronchial obstruction. Right hilar mass causing right upper lobe bronchial obstruction causing collapse, resulting in the appearance of the letter S. Okay?
But the sign sometimes may be seen also in the left upper.
But
Not
the
on
vast
right
majority is on the right side.
But
Very
many-
can be seen, of course, but very rarely. Yani. Okay? Like for example, you can see here it makes the letter S. Okay? the S sign of Golden. Whenever you see that, you suspect a hilar mass. طبعا malignant, of course. Yeah, this is the same in the CT scan. We will see a lot of examples. Just give me a few minutes, okay? It might be this S shape can be straight. It's the same. Again, it's the S sign of Golden. مش شرط. It's not necessary that it makes an S, okay? For example, you can see here. This is the previous example of consolidation and collapse of the right upper lung lobe due to a right hilar mass. On a CT scan, there is this big, huge mass that is compressing and narrowing the right main bronchus and its branches, resulting in the S sign of Golden. Another example here, you can see there is the opacification of the right upper lung zone with evidence of volume loss, elevated. Sorry? Yeah, the elevation of the right hemidiaphragm due to the collapse of the right upper lobe, resulting in pull of the diaphragm upward. And if you look carefully, you can see the trachea is also a little bit deviated to the right as part of the volume loss, and this is most likely due to some sort of right hilar pathology. Most of the times it's a malignant mass. Not always, we never say always. The previous, another example, you can see the opacification of the right upper lung zone, and with the CT scan shows this big right hilar mass that extends into the parietal pleural surface, okay? Another example here you can see of a S sign of Golden, this opacification here and volume loss, and with the CT scan you can see the same thing, the opacified right upper lobe that's collapsed. And again, on the CT scan there is no obvious like big bulky mass like we saw before. So on the PET scan you can easily appreciate the hypermetabolic lesion in the right hilum. So you may not always see the lesion as a big, ugly looking mass. Sometimes it might be small but obstructing. Okay? Again, the S sign of Golden alert us to the possibility of the presence of a right hilar pathology, most of the times malignant one. Okay? Now, the next sign is called Luftsichel sign. Luftsichel is a German word for what? What does it mean, Luftsichel? No, what does it mean? Luftsichel, what does it mean? Translate. شايفين المنجل؟ منجل مال الفلاح؟ Luftsichel. It means Luftsichel بالجرمن. Okay? اللي هو sickle. سامي sickle cell anemia وكذا. The sickle is the Luftsichel. Okay? So this is number one. So we know what it is Luftsichel. What do we mean? Now, what does it indicate? Left upper lobe collapse. Why? Okay, you can see here this lucent thing. It's like, looks like a Luftsichel, like a sickle. Okay? So, it is a German word for an air sickle, described a crescent lucency adjacent to the aortic arch in the left upper lobe collapse. Okay? Air represent superior segment of the left lower lobe between the aortic arch and the collapsed left upper lobe. So this is part of the lower lobe. The Luftsichel itself is part of the lower lobe that is interposed between the aorta and the collapsed upper lobe. Between them, this part, it's like a sickle or crescent. Okay? So, when you see that, it means there is a possibility of left upper lobe consolidation or collapse. Take a lateral chest x-ray and you can obviously see the pathology. Okay? This is an asthmatic patient. Here, there is a right middle lobe collapse you can see here the right heart border is not well defined, it's ill defined. Okay, after a while, 3 days later, there is now the Luftsichel sign is apparent. You can see it here very obviously. The part of the right of the left lower lung lobe is entrapped between the aorta and the collapsed left upper lobe. Okay, I have problem with the left and right. I always make mistakes. Anyway, you get the idea. So, some other signs. There is here, I think, kangaroos and cows and bobtails crossing and snakes and everything. You have to be careful. And here, if you go to swimming, the crocodiles will eat you. Silly signs. Again, very expressive sign. If you go, the crocodile will eat you. And this is a very confusing sign. No one knows right turn from left only. Anyway, another sign. Flat waist sign. Left lower lobe collapse. Flat waist sign. It is caused by cardiac rotation in the left lower lobe collapse, resulting in the slight right anterior oblique rotation of the heart. So, the normal concavity of the left heart will be lost. Okay? The aortic knob and the adjacent pulmonary artery the result will be loss of the notch between the aortic knob and pulmonary artery, and outline aortic knob completely lost. Yani, this is the normal appearance of the chest X-ray. When you see this, the waist of the heart الخصرة lost. يعني the heart مكرش فارش. Okay, as simple as that. Okay, you can see here this heart has no waist. Why? Because the left lower lobe collapse, when it happens, the heart will rotate. Okay, and this rotation will result in this change of the configuration of the heart. So when you see it, you need to make a lateral chest X-ray to confirm presence of a lower lobe collapse. And if you look carefully, you can see this is the collapsed lower lobe as a retrocardiac triangular opacity, which we miss a lot without proper history. We miss it a lot. And if you look carefully more, you can see the hyperinflated upper lobe compared to the right side. This is more lucent due to the collapse of the left lower lobe. So there are multiple signs to confirm left lower lobe collapse, and again, if you are not careful, you might miss it. Sorry? Cell? Cell sign of thymus. I don't know, maybe. I didn't hear of that. It's for the thymus. Anyway, we'll talk about it later. Anyway, again, you can see here in this example, you can see there is a triangular retrocardiac opacity. You can see the paucity of the pulmonary vessels compared on the left side compared to the right. Here it is less because the left upper lobe is hyperinflated, compensatory hyperinflation, and you can see that the heart has lost its waist. Okay, فقد خصره. Yeah, the left ventricular enlargement. You mean any ventricular aneurysm يعني? The left atrial enlargement, you will lose the aortic knob only. Left ventricular enlargement, you will have prominent heart apex. Here it is, the whole thing is lost. يعني. Okay. شلون يعني؟ Exactly. The left hemidiaphragm is not very well seen also in the collapsed. In this case, the left hemidiaphragm is not well seen, while in the atrial or ventricular enlargement should be seen more clearly. Okay. So another example here, you can see this flattening and you can see the triangular opacity, and on the CT scan you can see this. Compare it with 2 years earlier chest x-ray, you can see very nice waist, now it's lost. Okay, you can see the diaphragm here is more continuous, more well defined, now it's lost. Okay, and you can see there is no retrocardiac opacity, and now there is. Tamam? Like here, this waist that was here, it's lost now. Okay, another example, you can see here, what do we see here? There is this, when you go down further, there is lower lobe, left lower lobe collapse, and again previously, now you can see this, the retrocardiac opacity. I'm sorry, the images may be a little bit not very well organized, but the idea is very obvious. You can see the left hemidiaphragm is lost, and there is this retrocardiac, and compare the vessels between the left and the right. Obviously the left has less vessels. Tamam? Okay, 3 years earlier was not the case, was better. And another example here, what do you see here? ECG leads, which means the patient is in ICU. It's tired patient, okay? And compare the vascularity between the left and the right. Which one has more vessels, more pulmonary vascular markings? The left is less, exactly. The right is more, like you said, exactly. You can see the right left hemidiaphragm. Where is it? Huh? Absent. Good. And when we have a CT scan, you can see obviously collapsed. What? Left lower lobe. Good. Now, every lobe has its own features. We've seen most of them, a lot of examples of on every lobe. Now there is another sign that's a little bit outside of this topic, is the binocular sign, or completed donut or bagel sign. What does this mean? You can see these two rounded lucencies here and here on a lateral chest x-ray. The binocular sign or the completed donut sign, you know the donut؟ شايفين هاي النفس يسموه اكو bagel من عندها جاعوا صحن ياس كان نايم سوى بيها donut. It's visualization of the left upper lobe bronchus on lateral chest x-ray as a circle surrounded by soft tissue, usually related to lymph node enlargement. When the same occurs around the right upper lobe bronchus, it looks like a binocular. So it means that there is higher lymph node enlargement resulting in soft tissues around the bronchus present. Okay, so there will be what's called the binocular. The binocular is, you know, هذا المنظار binocular. The binocular sign. We'll see a lot. So you can see here the same as, sorry, just a second. Okay, you can see here this binocular sign. Okay, it indicates higher lymph node enlargement. Bilaterally or unilaterally, حسب. Binocular low donut sign. Okay, for example, you can see here. This is the binocular, the figure of 8, let's say. It's more than 2 bronchi. Okay, here it's 1. Here it's 2 binocular. Okay, another example. You can see here there is a hilar prominent, hilar on the left and on the right, and maybe less prominent on the left side. Okay, and you take a chest x-ray and you look carefully, and there are binoculars, 2. Okay, so the binocular sign, it's a lateral chest x-ray sign. Okay, What do we have here? We have this. How to describe it?
Well defined.
Okay.
Rounded
Mm.
with the radiolucent يعني central يعني wall radio opaque central cavity أو radiolucent
زين. Okay. Continue.
in the right middle zone.
Okay. So there is a right middle lung zone mass. This mass is obviously cavitating. It has a lucent center, okay, with a thick wall, okay. The surrounding lung is more or less clear, okay. This is the first thing. Now the second thing is there is a prominent hilum, and when we take a lateral chest X-ray to localize it or for further anatomical description, you can see the mass is posteriorly located, and you can see there is a binocular sign here, indicating or confirming hilar lymph node enlargement. And the next step is to go for a CT scan. You can see here the binocular sign, and the CT scan confirms there is a big mass here infiltrating everywhere, confirming the hilar pathology. Okay? Again, you can see here the binocular sign. If we rotate the image, just rotate it horizontally to make it to make it more like a binocular. This is the binocular. Okay? Other example, you can see here big hilum bilateral. Okay? When you take a lateral chest X-ray, you can obviously see, and I hope today when you go into the routine imaging, when you see suspected mass or something, do a lateral chest X-ray and look for a binocular sign or donut sign or bagel sign or whatever makes you hungry sign. Well, I love donuts. Anyway, so now it's a more famous sign, that is figure of 3 sign. Before I show you, what does it mean? Wait. Aortic figure of 3 sign. Aortic aneurysm. زين. Sorry? Unfolding of? Okay. Next. مروة. بس ما اعرفها. اكار. نياز. فضايح على اليوتيوب بالاسم ما افضحكم والله. يا معودين والله مشهوره. فيجر اوف 3 ساين. قلت لي انيوريزم لا غلط طبعا. اوكي.
ما متأكدة يعني
قولي حتى لو ما متأكدة. anything. ميديا يعني. correction of the earth. excellent. اوكي شوفوا عمتكم. So figure of 3 sign. It indicates correction of the aorta. اوكي لا aortic aneurysm ولا unfolding ولا مدري شنو ولا كذا ولا هاي الشغلات كلها. زين. أكار سؤال. Why did I put this image? I want to show you figure of 3 sign. This is the aortic knob and there is some sort of 3 configuration. Okay, we'll see a more example. But why this sign or this image, this magnified view of something? I don't know. What do you think? شنو؟ قولي. Okay. So what does it indicate? يعني بسمة قالت لك وعد قال لك ونياز قال لك وقرحتي على غير شيء تماما. ايش قلتي بسمة؟ rib notching, inferior rib notching, that usually seen with what? Correction of the aorta due to the prominent collateral circulation. When there is a correction of the aorta here, narrowing, blood will be shifted via collaterals to the rest of the body. This will result in the inferior aspect of the rib, okay, notched. And there is a differential diagnosis for causes of inferior rib notching and for superior rib notching. And they love it in the board. They love it, the differential of superior rib notching and inferior rib notching, the causes. Okay? So, the figure of 3 sign, there is a figure of 3 or contour of 3 of the descending aorta indicating the correctation of the aorta. And there are, of course, types of correctation. There is a preductal and postductal, and everyone has its own radiological manifestation. We will not go into that now. However, just for like quick, the rib notching indicates which type of correctation, pre or post?
If bilateral, postductal. Bilateral.
وماكو unilateral بس post. Bilateral rib notching, inferior rib notching indicates a postductal correctation, which is the most common, and they survive due to the collaterals. Preductal is severe and they don't survive usually, or they need immediate intervention. Okay? Because there is no collaterals to compensate, or much less collaterals, let's say. Okay? So the rib notching is in favor of postductal dilatation. And in practice, almost always you'll see a postductal correctation. It's very unlikely to see a preductal correctation.
Preductal, I think it's more common in children.
Both of them in children, it's a congenital abnormality. Okay? But the postductal, they tend to present later. يعني. It takes longer duration to present. Okay? I think we have some, like 5 or 10 minutes. Anyway, there is a sign that has a medico-legal consequence. That is the falling lung sign. What does it mean? Okay. So there is a complete laceration of the bronchus, so the lung will fall. حرفيا, literally, the lung is falling. ليش؟ لأنه من الهايلم, from the hilum, the bronchus is lacerated. Okay? So when you have it, the lung is falling, collapsed, واقعة. Okay? There is the central bronchial anchoring attachment of the lung is disrupted as a bronchial tear or fracture. Of course, always will be in the setting of trauma. Always. And severe, massive trauma. A patient will be in the emergency or in the ICU and will be a very critical state. Most of the times will be a portable X-ray. And you can obviously see here the presence of a possible what? Sorry? There is always pneumothorax. Here, what else other than pneumothorax? There is a tension pneumothorax. Okay, that needs immediate relief. You can see the heart is shifted to the other side, indicating tension. This is an emergency. This is a medico-legal thing. Now, another sign is the westermark sign. What does it indicate? There is a hyperlucent lung distal to an embolism. The embolism is obstructing a pulmonary artery, resulting in loss of flow to that lung. So the lung will be lucent or less vascular compared to the other side. This indicates pulmonary embolism, what's called westermark sign. So you can't diagnose a pulmonary embolism on a chest X-ray. طبعا there are other things, but you can. It's not impossible. Needs clinical, needs lab, needs طبعا of course chest CT angio, but you can't suspect it. When you see here, compare this lung with this lung. There is a very big difference between the lucency of this one and this one. Here there is a paucity of vessels, decreased vessels. And when they did the CT scan, you can see this embolism within the pulmonary artery. Yeah, the big طبعا you will not diagnose like a subsegmental embolus. I'm talking about the more major. So what are the signs associated with PE? We have the westermark sign, which is the decreased vascularity, the Fleischner or the knuckle sign, which is enlargement of the hilar vessels resembling a knuckle, okay, and the Hampton's hump sign, which is a wedge-shaped peripheral consolidation pointing to the hilum. For example, you can see here there is a pulmonary embolism, right and left side, major ones, okay, and you can see this, which is the Hampton's hump, okay, on a CT scan. On a chest X-ray, you will see what? There is paucity of the vessels, okay. You can see the knuckles. You can see the hilum vessels prominent like a knuckle, like, okay. We will see more examples here and there. Don't worry. This is a portable semi-erect chest X-ray. You can see this big prominent hilar vessel. The pulmonary artery is big, congested, engorged. Okay? واضح ولا لا? Due to why? There is something obstructing the blood, resulting in inflated artery, which is the embolism. واضح دلال؟
يعني انا قصدي مرات يعني شلون نميز انه هذا enlarged pulmonary vessel or this is a mass in the hilum?
You need to look for what other signs like hilum overlay sign. You need to have history. You need to do a lateral chest X-ray. You need to do a lot of other things. يعني to exclude the binocular sign.
يعني دكتور قصدي بس بالاكستراي.
Look for other signs.
Pulmonary business or mass? Hilum convergence sign.
We talked about it. The hilum overlay sign, the hilum convergence sign. You need to do a lateral chest X-ray to confirm sometimes. يعني there is a lot history. Why it is the X-ray was done? The basic thing, the history, the most basic thing. So there is a lot of in the hilum. You look for the either hilum overlay or hilum convergence sign. You can see it in the previous presentation. It is the X-ray. It is an X-ray sign, not a CT sign. If I have a CT, I don't need any sign. I will see it directly. So again, you can see this is the knuckle sign. You can see the vessels like this bulging like the fingers of someone. And you can see here the filling defects within the arteries of the lung, confirming there is pulmonary embolism. This is the knuckle sign. You can see it, big prominent hilum vessels. Another example here, you can see this big pulmonary artery, engorged, enlarged. Some people say should be at mid-course up till about 16 millimeter as a normal value, but I don't think that's very accurate. Or and some if you see it abruptly ending, it's again sign confirming the presence of some pulmonary embolism. Again, you can see here 3 weeks earlier it was like that, and now it is like that. It's much more prominent. Another example, this is the knuckle sign. You can see big one here, okay, and you can see the pulmonary embolism obstructing the blood flow here, okay. Now there is what's called this sign also related to the pulmonary embolism, which is the Fleischner sign, okay. This wedge-shaped area of decreased of infarction, pulmonary infarction, and this is what was this exam? Nuclear. What is it called? This is ventilation perfusion or VQ scan, okay, showing this area of lost radio tracer activity due to pulmonary infarction, okay. And again, you can see the big hilar sign here and here. It's bilateral pulmonary embolism, resulting in some faint, very faint wedge-shaped area, might be seen here or there. and you need a CT scan to confirm that. We will end with this sign. The end is near. Okay? See you next week, inshallah.